to go?
I'm just sending it now, but I can let people in.
Okay, thank you.
And we're now live.
And we're now live. Okay. So for people who are joining us on Facebook, thank you very much for joining. We're going to get started in just 2 minutes. We're just letting media into the media conference. And this is a media conference about what is no less than an emergency in terms of the staffing crisis in hospitals, long-term care and home care. And so we'll be talking about the extent, the sort of scale of the crisis. And the group today will be releasing a series of concrete measures that the Ford government must take in order to address this crisis. So we'll just give it a couple minutes and we'll get started. Thanks for joining. Sala, can you let us know once all the media is in?
Yeah. Okay, everyone should be in now.
Okay, wonderful. Okay, so as soon as we have it, could we please put the link to the list of demands in the chat for the media and put it in several times? And go ahead, Sala.
Hello, everyone, and welcome to today's press conference. As Natalie mentioned, we are here today. There are various organizations representing over 1 million patients, healthcare workers, and advocates, and we're here calling for emergency measures that need to be taken to deal with this healthcare crisis when it comes to staffing. So we're going to have various speakers, and then afterwards we're going to have a Q&A portion. For the media, we please ask that you indicate in the chat that you have a question. You don't need to write your question, just indicate that you have a question, and then we will call on you at that point. And then at that point, we'd also ask that you please indicate who you'd like the questions to be directed to. So I'll pass it off to Natalie Mera. Natalie is the Executive Director of the Ontario Health Coalition. Please go ahead.
Thanks very much. So to call the situation in hospitals, long-term care and home care in Ontario a crisis is not an overstatement. In a number of facilities, staffing has actually crumbled. In others, we're seeing the lowest staffing levels that we have ever seen, and that includes previous waves of the pandemic. In recent days, the number of outbreaks in healthcare settings has escalated really dramatically. At this point, we have around 390 outbreaks in Ontario's 626 long-term care homes. We have 268, so approximately 270 outbreaks in retirement homes, more than 200 outbreaks in Ontario's hospitals. And we are hearing, and there are literally thousands of residents and patients with COVID-19 every day. In the last week, for example, 1,319 long-term care residents contracted COVID-19 and 506 long-term care staff alone, and 38 long-term care residents died. The deteriorating staffing situation has a profound impact on patient care. And so our message today is that we're not on the cusp of a healthcare crisis. We are in a healthcare crisis. That is not an overstatement. 75 long-term care residents are on lockdown. They've been on lockdown, many of them for more than a month. We are hearing from residents who have not had a bath or a shower since before Christmas. It's January the 14th. We're hearing from families who are watching the deterioration of their loved ones in long-term care from isolation. We are hearing about staffing levels that are so extreme, there would be no possible way to provide care for residents in long-term care at those levels in normal times, let alone when they're on isolation, each in their own rooms, and with many of the residents sick with COVID-19. This is the same as what we saw in the horrific waves 1 and 2 in long-term care. And but the resilience, what resilience there was left in the healthcare system at that point, has now been burned through. Hospital after hospital are reporting hundreds of staff off sick. Clinics have been closed, a whole range of surgeries canceled all across Ontario. Even emergency departments have been closed overnight or for days in order to redeploy staff to critical care. We're seeing a whole range, even hospital sites, urgent care centers in hospitals being closed down in order to redeploy the remaining staff to other parts of the hospitals. If this is not a crisis, what would possibly define a crisis in healthcare? And so we have pulled together organizations representing more than 1 million people to lay out very clear, concrete measures that range from deploying the military, absolutely needed to the extent that the military has the resources to do it, to deploying rapid response teams, an emergency health human resource deployment system, more the desperate need for leadership and coordination from the Ford government, answers as to why nothing has really been done to redeploy and get boots on the ground, fast track credentialing of the available staff, internationally trained staff for nurses and health professionals, as well as calling the retirees back in, fast tracking the credentialing, waiving their licensing costs, and getting boots on the ground in the facilities and in home care as quickly as possible. There is a pandemic of COVID-19 out there that is a clear and present danger to people's health, there's no question. But there is also an emergency of a health crisis of staffing shortages that is resulting in irreparable harm, irreversible harm to patients and to residents. Clear, urgent leadership on this is missing, and it's needed now desperately. So we've outlined a whole series of measures to deal with the immediate emergency, and then also to address the long-standing staffing shortages in healthcare and the structural conditions that have led to them, including the deterioration of wages and working conditions across the healthcare sector. And I'll leave it to the speakers to flesh out what the situation looks like on the ground in healthcare right now, and what we're calling for the Ford government to have to answer to, why they haven't done it and start to do it immediately. I just want to end by saying we are the front lines of healthcare. We represent 1 million frontline healthcare workers, frontline to this crisis, patients, residents, home care clients who are experiencing right now the terrible consequences of failure to plan prior to the pandemic, failure to resource the healthcare system adequately prior to the pandemic. And certainly now we're in wave 5 of the pandemic. Healthcare workers still do not have N95 masks, even in facilities with outbreaks. While the residents are on lockdown, there has been no pre-planning and no deployment of resources in this wave to deal with the crisis in the way that one would expect in the 5th wave of a pandemic. It is unconscionable, and this is a clear, urgent call to raise the alarm for Ontarians, and also to call to account our politicians who are doing far too little. Okay, so I'm going to turn it over. The first speaker could, maybe Sala, could you put the name and title of the speaker in the chat for the media? And so the first speaker is Katha Fortier, who's assistant to the president at Unifor.
Thanks, Natalie, and thank you to the coalition for arranging this meeting and coordinating our list of demands, which is really critical. I don't think that anybody could have imagined 22 months ago that we would still be here in the fifth wave in what is essentially a humanitarian crisis in our healthcare facilities across the province. First, I'd just like to say that Bill 124 that limits compensation for frontline workers blatantly discriminates against women, specifically women in healthcare, the nurses, the personal support workers, the cleaners, the clerks, the technologists, so many frontline workers who have carried us through this pandemic, and some who have given their lives. I think that, there are real solutions here, and I think that an immediate show of good faith should have been done. This should have been done yesterday, is the removal of Bill 124. Quite frankly, even without Bill 124, healthcare workers' compensation over the last decade has not been, for the most part, has not even been as high as inflation, and workers have left. Workers have left for other options. Workers can get jobs in the United States very easily. This is something that we need to make sure that we're doing everything to attract these workers back to Ontario and back to working. As Natalie has mentioned, we have nurses that have retired. If they choose to come back, we should be fast tracking their registration. A registration for workers is over $300 a year. And quite frankly, waiving those registration fees for people who return would be another show of good faith. And then, of course, there is just the immediate need to increase the availability of full-time work so that people still aren't working multiple workplaces. We need to improve compensation. There should be pandemic pay for all workers. Quite frankly, every healthcare worker in the province of Ontario is working under an emergency order that supersedes their collective agreement rights, that forces them to work overtime, that cancels their vacation, that can redeploy them, reassign them on a moment's notice. And all of those workers on the front line deserve pandemic pay. This is no longer a crisis. Well, it certainly is a crisis. It is a catastrophe, and immediate decisions must be made by the Ford government and implemented immediately. And we sincerely hope that they listen to these recommendations. Thanks so much.
Thank you very much, Katha. And just to put, for places like long-term care homes where they have been paying, 1.5, above normal wages in order to keep staff, the really good homes that have tried from the beginning to retain staff and provide extras to keep them in, understanding that their wages have fallen behind, understanding the risks that the workers have faced, it has actually made a huge difference in terms of the staffing. So this isn't sort of opportunism, calling for something in a moment of crisis. It is actually working where it's being deployed and needs to be deployed across the board. Okay, so next we have Sandra Coletta, who is the organizer of Advocates for Long-Term Care Reform, which is a group that represents about 4,000, mostly family members of residents in long-term care home and some frontline workers. Thanks, Sandra. You're on mute, my dear.
Hi, Natalie. Thank you. I would like to start by echoing the sentiments of Natalie and Katha in saying that our healthcare system is not really in a crisis anymore. We are in a state of emergency. In long-term care, things have been horrific in this wave so far. The suffering of both staff and residents is immense, and the burden placed on them is unmanageable. Over the past couple weeks, we received so many startling reports from both staff and families about what's happening in their long-term care homes. And I'd just like to share some of these stories with you just so people can get an idea of how bad it really is. From staff, they're reporting extreme exhaustion. They're so short-staffed and their workloads are so heavy that they can't provide residents the care that they need. Several PSWs have told me that they're at a point now where they have to pick and choose which care is most important for residents to receive, and they can't even meet the basics anymore. Staff are reporting that they're not getting any breaks. They're run off their feet from the time they walk in the door until the time they leave, and often they're asked to stay later than their shift. Staff are being tested using rapid antigen tests, yet they're forced to start working before their test results come back. This makes so many people uncomfortable. But there's not enough hands on the floor, so management forces them to start as soon as they walk through the door. As Katha mentioned, time off that has been booked is now being canceled. These are people who haven't had a break in 2 years, and now they're being denied days off because of the shortage. They're extremely exhausted, and at a minimum, they should be getting the time off that they need to recover. From families, we've heard the same thing, that there are severe shortages. One family reports that in their home, there was no PSWs available for an entire day, only an RPN on the floor. Residents were not getting fed or changed at all. So that's one RPN for 33 very high needs residents. And despite the severe staffing shortages in many homes, essential caregivers are once again being locked out. This leaves families unable to provide care for their loved ones, and really we're minimized to watching from outside a window and watching them decline once again. And aside from not being able to get in and help, families can't even get reports. One family member detailed to me that they've been calling every single day for 2 weeks to try and get an update on their family member, and there's simply not enough staff to even answer the phones and get an update. She says the only thing that she can do is go to the window to make sure that her mom is still alive. Meals are being served in styrofoam containers once again, yet residents don't get the help they need to eat these meals because there isn't enough staff to go into every single room and feed residents. Families are detailing untouched food left at the bedside or nightstand, and residents can't access the food themselves. Showers and baths have been stopped, either due to outbreaks or staff shortages, and residents in some homes have gone weeks without a bath or shower. This includes residents who are incontinent and rely on these baths and showers to keep themselves clean and prevent infections and UTIs. Residents are being placed in isolation once again as soon as there's even a suspected case of COVID. One family member tells me they haven't seen their loved ones since December 15th, and they can't even speak to them on the phone or by Zoom because there's not enough staff available to help facilitate these calls. So that's almost an entire month of isolation for residents now who are triple vaxxed because there simply isn't enough staff. The isolation means so many residents won't get the basic care they need, including foot care, dental care, physical activity, physiotherapy, mental stimulation. The list is endless. They're literally sitting in a room 24/7 with nothing to do. As you can imagine, this prolonged isolation would have devastating effects on most of us. But when you have dementia or Alzheimer's or brain injury, it's that much worse. Finally, another family member reports that barricades are being set up at their loved ones' homes to prevent residents from leaving their rooms. They're pushing nightstands, tables, hampers, pretty much whatever they can find to keep residents from getting out. So we're in here 2 years later. We haven't learned a thing. Staff has not been replenished. So we at Advocates for Long-Term Care, all the families and staff, were asking for emergency measures to be taken to increase staffing immediately and to get back up into homes who need help now. Residents need help and staff do as well. Thank you.
Thank you very much, Sandra. It is awful. The stories we're hearing, really, really horrific. And a number of families are here on the call today and are available to media if people want to get a sense from the families directly about what's happening to their loved ones in long-term care homes or in hospitals. Next, we have Angela Priocannon, who is the first Vice President of the Ontario Nurses Association. Thank you, Angela.
Thank you, Natalie. Good morning, everyone. My name is Angela Priocannon, and as a registered nurse, the first Vice President of the Ontario Nurses Association. I want to thank Natalie and the Ontario Health Coalition staff for organizing this important media conference. We are all here today to fix Ontario's nursing and healthcare workforce crisis. Let me be clear, this current mess could have been prevented had the government listened to and acted upon our counsel and advice. We are here today to put forward the demands of our members in all sectors so they can provide quality patient, resident, and client care. Nurses and healthcare workers are overworked, burnt out, and suffering moral distress because we fear our patients are not getting the care they need and deserve. In fact, Ontario needs more than 22,000 registered nurses just to catch up with the rest of Ontario. We have the worst RN to population ratio. That is shameful. ONA has repeatedly tried to work with government to improve nurse retention and recruitment, but there's been no comprehensive action. I hope the government is listening to our demands put forward today. On behalf of our members, ONA is calling on this government to do the following. Repeal Bill 124. We all agree that Ford's wage suppression law has to go. Mandate airborne precautions for COVID-19. Guarantee access to N95 respirators for all healthcare workers. 10 permanent sick days for all workers. Wage parity across all health sectors, and more full-time positions, including 70% full-time staff. Fix clinical placements so that nursing students have hands-on learning opportunities and support. And the bottom line, protect public health care. Stop the privatization of hospital services, long-term care, and home care. We all know what needs to be done to stop this staffing crisis in its tracks. The government must listen to us and act on our demands now. We have no time to waste. On behalf of the Ontario Nurses Association, thank you for listening.
Thank you very much, Angela. Michael Hurley is the president of the Ontario Council of Hospital Unions, CUPE.
Thank you very much, Natalie, and the Health Coalition and all of these organizations, and to the media for coming today. Today, we're calling on the government to deal urgently with the crisis in healthcare staffing and to deal with it systematically, not by bringing staff who are sick with COVID back to work with frail long-term care residents or immunologically vulnerable hospital patients, but systemically and profoundly. Going into COVID, Ontario had the fewest hospital staff and beds to patients of any country in the OECD, and the second fewest level of staff to residents of any province in Canada. These staffing levels cause workloads which are impossible and leave nurses, PSWs, and other healthcare workers with the daily knowledge they have not been able to do enough for the people they care for, and eventually it's just too much for too many. The work is physically and emotionally exhausting, and most of it is part-time. 75% of home care work, 60% of long-term care work, 50% of hospital work. People work multiple jobs. They beg for extra shifts. Wages have been held below the rate of inflation. In 2021 alone, these workers will take a real wage cut of 4% because of Bill 124. Kind and generous words don't make up for this reality. The safety of these workers has been ignored. Their workplaces have a terrible and unchecked problem with racial, sexual, and physical violence. And during the pandemic, these healthcare workers could not and still cannot get in too many numbers access to the protective equipment they need to work safely. And as a result, tens of thousands of them have caught COVID, and by our count, 24 have died. This feeling that no one cares about their safety is a key factor in the demoralization of healthcare workers. Quebec has dealt with the problem of understaffing in long-term care by announcing a year ago the hiring of 10,000 personal support workers into long-term care in full-time jobs, with a minimum salary of $26 an hour with pensions and benefits, and 87% of the people they recruited have stayed. In Ontario, the targets for hiring do not even match the loss of staff to attrition in long-term care, let alone grow to meet the magical 4-hour care standard the government has set as a target. In Ontario, a comparable move to Quebec's would be to hire something like 17,000 full-time PSWs, and that's the level of staffing that's called for. There is no staffing plan in Ontario for the hospital sector, and yet all of our internal polling suggests there will be an exodus after the pandemic. And this exodus will be driven by frustration over ongoing real wage cuts and the pervasive feeling that no one really cares about these workers' safety or that of their families. People are holding on out of loyalty to the people of Ontario and to their co-workers. Today, we are calling on the government to return to the front lines. We're asking them to recall the legislature, put in place a real plan to staff up healthcare in this province. Lead as Quebec has done by creating thousands of full-time jobs. Repeal Bill 124, which dooms healthcare workers and hundreds of thousands of others to real wage cuts. Make safety of this workforce a real priority. Stop rationing protective equipment. Work to stop violence in healthcare workplaces. Invest in mental health supports. Offer hope to the workforce. These things will turn this staffing crisis around, and that's what has to happen for the care and well-being of the residents in long-term care and the hospital patients that all of us care so much about. Thank you.
Okay, thank you very much, Michael. I'm going to ask Trish McAuliffe, who's the president of the National Pensioners Federation, an organization that represents more than 1 million retirees across Canada, to speak.
Yes, good morning, everyone. And thank you to Natalie and all the advocates for our seniors across Canada, especially those in long-term care and today facing the crisis in hospital care. I am here because this is a humanitarian crisis across Ontario. Our members are asking us to put a call out to all Ontarians to get all hands on deck and inform others. If you don't have someone that is in care need right now, share your story, reach out, let people know. This needs the drastic attention that the Ontario Health Coalition has called out for and demand and must be met. Our members across Ontario, 300,000 strong, are advocating for you. And to respond to Michael Hurley's comments that no one cares, our members care. Ontarians deeply care about the crisis that the workers are working under and must be met under the conditions that have been laid out today. I'm wondering if Rod Phillips and Christine Elliott are responding to the calls that I get on a daily message machine that I can listen to time and again, or that catch me personally, that recount the emotional toil that is being spent on families when they can no longer support their member, whether it's in the hospital or in long-term care, because they are sick themselves, but understand the dire situations that are there, and their mother or father can't even reach for a glass of water. They're sitting without care, and it is a crisis. There is no word about it. What is keeping you up at night, Rod Phillips and Christine Elliott? All of us here on this screen, I know, lose sleep about this. I want to know what you're ready to do. The 300,000 members here in Ontario understand. Do you? You're not replying. You're not sending letters back. We're not hearing from you. And this is disgusting, to say the least. You are our leadership, and you're given none so far. So why? Why is this happening to our families? Why are they under so much emotional stress that they've become sick themselves? Why do I receive these calls? Our advocacy is clear. Please respond.
Thank you very much, Trish. It has been shocking to see that there's absolute staffing catastrophe. There have been no rapid response teams sent in. There is no plan. There is no emergency plan. They're simply leaving the residents and the patients there to suffer irreparable harm in many cases without care. And Ontarians need to understand that that's the situation, and the Ford government needs to be called out on it. They cannot sit on their hands and do nothing, or as they did last week, announce, teeny tiny measures, 300 internationally educated nurses, not even a drop in the bucket when we're tens of thousands behind. It's ludicrous. And so I hope that the message of urgency and the complete lack of political leadership here, policy leadership, is very, very clear to people. I'm going to move on to Jill McElraith. She's the chair of the Healthcare Divisional Council for OPSEU. Go ahead, Jill.
Thank you, Natalie, and thank you for inviting me to speak today. And as I was introduced, I'm chair of OPSEU's Healthcare Divisional Council. I work in hospital support as an RPM. There are lots of support positions in hospital too, like PSWs, clerical staff, food services, environmental services, and they're all incredibly short-staffed. RPNs, for example, have been asked to do the jobs of missing RNs, leaving even a greater shortage of RPNs. We also have a major shortage of hospital professional staff. Laboratory technologists have had to do all the COVID-19 testing on top of all the other testing with the same number of staff. Pharmacy technicians are leaving hospitals to work in higher paying vaccine clinics. Respiratory therapists and diagnostic imaging technologists are leaving hospitals for better working conditions in other workplaces. The pandemic is burning hospital professionals out. Many are retiring and they're not being replaced as they leave. 50% of laboratory technicians will be eligible to retire in the next 3 to 5 years. We need a long-term commitment to train and hire hospital professionals. It can't be done overnight, so we need to start right now. People are leaving hospital work because nobody feels safe in a hospital right now. We're risking our lives. We know when we go to work, we're going into COVID. We're constantly being called in for overtime. We can't take vacations. And given all that, we can't even negotiate higher wages under Bill 124. We need to repeal Bill 124 and immediately boost the wages of all hospital workers. Mr. Ford is going to have to open his purse strings, or the healthcare heroes will keep handing in their capes. Home care understaffing is a crisis as well. During the pandemic, hospitals are pushing patients out of hospitals and into their homes more quickly to limit exposure to COVID. As a result, community nurses and PSWs are dealing with more complex cases. There's always been staff retention issues in home care. For-profit owners of home care companies undercut wages, benefits, and full-time work. The way forward for home care is obvious. Increase RPN and PSW wages permanently and stop giving contracts to for-profit home care companies. Home care should be publicly run. OPSU represents many workers in long-term care, retirement, and related facilities. Staffing shortages have reached a breaking point in this sector. And we know why it's happening there too. They're not getting paid enough. They're getting sick with COVID. They have to care for way too many residents with too few staff, as we've heard this morning. So they're burning out and they're quitting or going on stress leave. We have to pay long-term care workers more. We have to have strong infection control procedures in every home so staff don't get sick. We have to mandate a staff to resident ratio of 4 hours of care per day per resident, and inspectors have to be allowed to enforce it. And most importantly, we have to get profit out of long-term care. For-profit owners will always understaff and cut corners on care when there is a profit motive to do so. Stop selling public land to private developers to build long-term care homes. Stop issuing operating licenses to private for-profit companies. From this point forward, we should make long-term care fully public. We know what we have to do. The government just has to do it. Thank you.
Thank you. For media and for the public, to let you know that the list of demands is on our website. These are emergency demands to get boots on the ground in healthcare to deal with the crisis immediately and to begin to implement the measures that we need to get the staff into healthcare over the next couple of years so that we can deal with the structural crisis level staffing shortages in the system. I'm going to move on. We just have a couple of more speakers, each of whom are not going to take more than 2 minutes. And I'm going to welcome Nick Popolo, and he is the chair of the Family Council Coalition for all of the Sienna long-term care homes. Go ahead, Nick.
Thank you, Natalie. Thank you, everybody. So I'm just going to give you some insight as to what we're seeing happening at all the Sienna homes. As discussed already in this conference, issues of residents not being bathed, feeding. Of course, it's more difficult to feed residents when they're locked in their rooms than when they're in a central location. We're getting calls from family members from all the Sienna homes, but not just Sienna, but I'm also getting calls now from long-term care homes from other companies with the same issues. And it looks like we're going right back to where we were during the first and second wave, where we were denied entry, family members were denied entry to see their families and to help out. Staffing issues are occurring. And you know what happens next. You just get residents that are just dying of neglect, dehydration, and starvation. What I find interesting is that we received 2 correspondence from Senior Living after months of issuing them letters, open letters, explaining our stress that's happening with the families and the residents. And we finally got 2 correspondence, one after each other. One is a letter from Sienna Living Executive Vice President Jennifer Anderson to all family councils of Sienna Living, dated January 11th, and indicates staffing issues impacting Sienna Living are are serious and impacting all Sienna Living residents that they operate. Then there's a newsletter that was issued on January 13th by President and CEO of Sienna Living, Nitin James, that indicates one of the biggest challenges of this wave is the impact it's having on staffing. This is something new for Sienna Living to admit that there's staffing issues. We know what happened during the first wave and second wave. All they did was deny that there were any staffing issues, and we know what really happened by reading the military reports, where staffing was atrocious, 1 to 30 or worse. So for Sienna Living now to come out and actually admit there's a staffing issue, that gives you some sort of impact as to how serious this issue really is. I'm just beside myself, the amount of emails and phone calls that myself and my wife Nancy are receiving from family members, and how stressed they are and how concerned they are about their family members. This is a very, very serious issue. I don't understand why the bridge government that we have now is not listening. I've been sending them correspondence as well, CCing them with all the Sienna Living correspondence. And what I don't understand is why they don't meet with us. We are the people and the families, the nurses. Why are they not meeting with us to sit down with us to see how we can resolve this issue, how we can work together? Instead, they choose to ignore us, and they choose to put our family members in harm. This is it's just terrible. Thank you.
Thanks. And Nick, Sienna, as well as I think Darlette, have asked family members to volunteer or to apply
Yes.
to work in the homes all across the province at this point, correct?
This is in the correspondence we got on January 11th from the Vice President, Jennifer.
Yeah.
Basically asking family members to go in and assist the staff.
Volunteer, yeah.
In volunteering and helping to take care of residents because they're in dire need. If that doesn't tell you what's going on in these places, I don't know what is. When they're begging family members to come in and help, you know, we would love to do that, but some of the homes, they're in lockdown now. We can't even go in and assist them. So we're just beyond those.
Okay, thank you. Okay, we need to be quick here. So I'm going to move to Sherry Sorensen, who is a PSW and from the United Steelworkers. Go ahead, Sherry, and you're in long-term care as well.
Yeah, thanks for having me. I've been a PSW for the last 12 years. During the first wave, we lost close to 20 residents. What they don't tell you is the number of people we lost afterwards, from the dehydration, from them giving up, from them not eating, deterioration from not moving. And here we are, we're doing it again. And a typical day for them, they get to see me for 10 minutes in the morning to get them up. They'll see me again to drop off food in a styrofoam container. They'll see me again, if they're the lucky ones, to have to go to the bathroom. If not, they're going to wait for them to go to bed. They haven't been getting showers. There's not enough staff to go around to feed them properly, so they're not drinking enough. We're getting tired. We are depressed because we know we're not doing our job like we should. A lot of us want to leave. I've thought of it, you know, maybe I can come back when it gets better, but I can't leave my residents and I can't leave my coworkers. And I feel like we're all in this boat and the boat's sinking. There's no help.
Thanks, Sherry. Okay, and last but not least, of course, is Patty Coates, and she's the president of the Ontario Federation of Labor. Go ahead, Patty.
Thank you, Natalie, for inviting me to this crucial call to action. You know, as we've heard today, we are seeing right before our eyes a domino-style collapse of our healthcare system with fumbling Ford at the helm. We know that healthcare workers dropping out of their professions in droves because the conditions and pay are so poor. They feel demoralized. And those who remain in the field are being asked to put themselves in dangerous situations because Ford failed to institute pandemic precautions over the last 2 years. In this pandemic, Ford has failed to deal with the staffing shortage. Ford has had 2 years to enhance ventilation. He has had 2 years to source proper respiratory protection. And Ford has had 2 years to provide 10 permanent paid sick days, fair wages, and tens of thousands more jobs needed to fight this virus. Instead, he introduced Bill 124, a 1% wage cap over 3 years for frontline workers like nurses and paramedics and long-term care workers. Bill 124 must be repealed immediately. He allocated thousands of new beds for for-profit long-term care homes that have been the epicenter of negligence and death. He has refused to recognize the airborne nature of this virus and the precautions that come with it, and is continuing his efforts to create a two-tiered private and public healthcare system, such as by blocking access to testing. He stands at the podium praising frontline workers, but insults them with his actions behind closed doors, or when he disappears for days whenever the system is in crisis. This is why the OFL supports our healthcare affiliated unions, their members, and the Ontario Health Coalition on the numerous demands needed to move us out of this extreme emergency. In the meantime, Ford needs to face the crisis that he has created, recall the legislature, and try to salvage what's left of our healthcare system and workers. He owes our frontline workers that much and so much more. And we won't forget come June. Thank you.
Okay, so thank you very much. So can we put the link again to the actual demands in the chat? And I just want to refocus on the actual demands. So we're calling for the military to be called in. We're calling for emergency rapid response teams, health human resource emergency deployment system to be created. We're calling for actual leadership and coordination from the government. We're calling for immediate fit tested N95 masks for all healthcare staff. You'll see from the families here, the majority of them who have family members in long-term care homes, the staff do not have, and the majority of the staff do not have N95 masks, even now, even after the residents have been put on lockdown for more than a month. It's unconscionable. It's completely indefensible at this point. Everyone going into a healthcare facility should be wearing an N95 mask at this point, and we're asking the government to require that. We're asking for all boots on the ground, everyone that can be deployed in to help. That's internationally trained workers, that's retirees, clear the path, fast track them, get them into help. Much clearer and consistent communication, transparency, and urgency from the provincial government to the public on these issues. Clear public reporting of actual staffing levels, no more playing games with what an outbreak is and what an outbreak isn't, and trying to stifle the public release of the numbers and the severity of the situation. Then in the short term, we need an immediate boost of staffing like Quebec has had done in the summer of 2020, in which they planned for 10,000, they set a target, they got more than 7,000, pretty good in the middle of a pandemic. They fast-tracked their training, it was intensive. 3 months later, they were able to deploy more than 7,000 PSWs into long-term care, and the second wave was better in Quebec. In Ontario, it was worse, and nothing has been done since then except for ad hoc PR-driven announcements that don't actually translate into boots on the ground in healthcare. And so that needs to happen for PSWs, RNs, RPNs, and healthcare professionals where there are shortages like respiratory therapists, laboratory technologists, pharmacists, and diagnostic imaging. The workforce has already experienced a decade of wage suppression. Bill 124 is both symbolically a slap in the face to healthcare workers and in very real terms is contributing to them leaving. And so Bill 124 has to be repealed. It is shocking that in the middle of a pandemic in which healthcare workers have sacrificed so much already, that they would be facing wage suppression legislation. The Ontario government must bring in paid sick days. Set clear targets for staff recruitment, retention, and training that actually meet the need for the number of staff that we have. Every announcement that we've had so far is less than half of what is needed across the healthcare system. So there is no plan whatsoever to get us out of the staffing crisis. And then there are the longer term measures to deal with the structural issues that have contributed to to the decline in wages and working conditions and the loss of healthcare workers. We need a ratio of 70% full-time staff. Staff need full-time jobs. They can't cobble together a living with 3 different jobs and continue to do that endlessly. And we're seeing the consequences of that. We have to ban the use of predatory private healthcare staffing agencies that are engaging in price gouging in the middle of a pandemic. They are corrosive on the healthcare system. We'll have nurses working beside other nurses. Nurses, if they leave, can be hired and paid double what the nurses who stay are being paid. They don't have to work weekends and evenings. And so it's encouraging staff to leave. They need to be banned. Violence needs to be addressed seriously as an issue. Staff levels and training need to be safe to prevent violence. The government has to create a plan for wage parity across hospitals, long-term care and home care, who are competing against each other for the same workforce. Stop the for-profit privatization, which is siphoning money away from the front lines and care levels in healthcare, and report publicly and transparently on the progress on these issues. We're serious, and we're asking the media to please finally hold them to account for not having done anything at this point to move us forward on these issues. So I'll open it for questions from the media. And so if everyone else can sort of stay out of the chat at the moment, if you have a question, could you indicate in the chat? And then we'll call, you don't have to put your question in the chat, just that you have one. And then we'll ask you to go ahead. Thank you very much for your patience. Do any media have questions? We also have individuals here who are family members of people in long-term care and hospitals and can describe what it's like on the ground, as well as some workers, frontline workers. Any media questions? We'll just give it a minute for people to identify themselves. Riley, will you let us know?
Yeah, we've got Morgan Campbell with Global News.
Oh, great. Hi, Morgan. Thank you. Go ahead.
Hi. I think this question is for Chris Sorensen. Can you expand a little more, or I'm sorry, I called you Chris, it's Sherry. Sherry, can you please expand a little more about the mental, the toll this is taking on your mental health to, have to go in there day in and day out and see the level of care being provided, but also seeing the impact that it has on not just only yourself, but your colleagues as well?
Some of them have told me that they go home and they cry. We know at the end of the day that we're not doing all the care we're supposed to do. It is true, you have to pick and choose what you feel is the most important. The cleanliness goes. They're not getting their showers. You're probably not getting your teeth washed. We all just have had enough. Some of us have said we want to leave, but we can't because we're all they've got.
Great, thank you, Sherry. And a quick follow-up for Sandra Coletta with the Advocates for LTC Reform. Sandra, how tough is it to sit by and see a lot of the same issues replay as if we were almost in the first wave and seeing, just depleting staffing levels, but care going down and, concerns being raised by family members who have essentially been locked out?
At this point, stating, I personally lost my own mom in the first wave. And back then, there was a lot of unknowns. So we kind of gave a lot of leeway and there was a lot of forgiveness from families. But that we're sitting here 2 years later and we're seeing the same mistakes happen. We know so much more about COVID now. We know that these residents don't need to live in isolation. We know families can go in safely. We know staff need our backup. There's just no excuse for what's happening in long-term care now. Staff has not even been addressed. I know myself, many of our thousands of members have reached out to Mr. Ford, to Mr. Phillips. No one's getting a reply. Like, where is our absentee Minister of Long-Term Care? And why isn't he addressing this severe crisis? There's just no excuse for it 2 years in, zero. And it just makes it that much more devastating. Like all the lives that were lost in waves 1 and 2 were in vain. We learned nothing.
Perfect. And just one last quick follow-up. I just see nobody else wrote in the chat here. Natalie, I think when I looked, I saw 62 participants on the call, obviously including media, but a lot of participants. It's a lot of people weighing in on this. What kind of message do you think that sends, Natalie? And why was it important to bring everyone together?
Honestly, if we had put this out to all of our membership, we would have had thousands on the call. This is our long-term care action group, which is mainly families who volunteered to try and coordinate actions across Ontario to protect and improve care for residents in long-term care. And with, maybe 24 hours notice, honestly, the level of concern among patients and their families, among workers and their organizations is beyond anything that we've ever experienced, because things are, each wave, the resilience in the healthcare system gets burned through, further and further. At this point, we're seeing literally thousands of healthcare staff off sick with Omicron, thousands that have left, and really just deteriorating care to a point that is terrifying to me. Looking at what we're seeing this week in long-term care, what is going to be the case 2 weeks from now? And there just are no measures being taken. Nothing is happening commensurate to the emergency that we're seeing across the province. There's a total failure of leadership here. And we're not saying this to score political points. We're saying this to pour on the pressure to get some actual action that would actually, improve things and save people's lives.
And sorry, I feel like I'm taking this over, but I do have a question for my colleague, Matthew Bingley with Queen's Park. He is wondering, how hard is it for hospital staff to be overburdened by the staffing issues? I don't know if this is maybe a question for Michael Hurley or Ona, but it would be great if we could have the key stakeholders weigh in, please.
Angela, then Michael?
Certainly the crisis that we're having in the shortage of nursing has impacted our patient care. We're hearing stories out there that, a nurse comes into work and has an assignment of 1 to 30 patients. And this is unacceptable. This is absolutely unacceptable. And we're struggling with why the government and previous governments think that the nursing shortage has not been there. We've 2 decades we've been fighting this battle, and it is impacting our membership tremendously. The level of mental health issues that has come out from all of this is devastating to our membership. Michael?
I think people are, this is 2 years now that they worked without vacations. They worked extended shifts. They worked extra weekends. They worked extended hours. They haven't been provided with the protective equipment that they needed, but they've kept working anyway. They're really distressed when they see people who urgently need cancer surgery, for example, who see those surgeries being delayed because we just don't have the capacity. They don't comprehend a lot of the moves the government is making, like, for example, suggesting that people who are off sick with COVID should come back to work to look after patients who are in a frail condition and certainly can't withstand a bout of COVID. So I think you've got a workforce that is really struggling here and wants to see from this government some substantial movements, not just in the immediate. And Health Coalition has a great list of those, but also in terms of turning the ship around and building capacity in the Ontario healthcare system and the hospital system to be able to meet patient needs as the population ages. I think that's what they're looking for. And if they don't see signs of life there, a lot of people are thinking about packing it in. Unfortunately, they just can't continue.
Thanks so much for that. And Matt's follow-up is, and feel free whomever on this conference would like to weigh in on this, but how hard is it to see patients, hospital patients, lying around with really no one to care for them? I'm not sure if maybe we have someone on the front lines who can speak to that, because I can't imagine that is easy. And then if anyone else wants to follow up, we are more than happy to hear what you have to say.
So is there someone here who's got who can describe that situation from the frontline perspective?
I can, Natalie. The nurses are telling us the stories that are devastating. They're going into work and seeing patients unattended. They're looking at, trying to triage what is the most important part of the day that they have to follow through with at that time. When you have a patient assignment of 1 to 12 patients on a night shift and you are it, we're being told now that we have to triage what needs to be finished, like those things that are the essentials, the things that need to happen immediately. And our nurses are suffering. They go into work, as was described by one of our, Sherry Sorensen, going into work crying because they know that they cannot give the care that our patients deserve. Then going home and saying, I don't know if I can do this again tomorrow. Those are the things that our staff and our members, and that's what our patients are having to face, is these nurses, healthcare workers are just struggling so desperately, and the patients are the ones that are suffering.
I would just
Thank you.
add to that as well, that they're working above and beyond even their own personal scope of practice for nurses. The reality is that they are redeployed on a regular basis or reassigned to a unit that they're very, very unfamiliar with the type of care that needs to be given. You could be an obstetrical nurse and all of a sudden you're working in the ICU. The strain and the stress of all of this, of being, not only fearful and worried about the patients that they're caring for, but there's also this fear that their license is in jeopardy when they're going to work, when they're working short, when they know they don't have the colleagues and the resources that they need to collaborate with. It's a really, really frightening situation in the hospitals. And I know a lot of workers are really terrified of what they're seeing and what's happening.
Can I jump in there, Natalie?
Yeah, Trish was waiting. I'll let Trish go quickly first and then you, Nick.
Yes, just quickly, I'd like to really express to those from the media, what is dire right now is that I am receiving calls from Ontarians, not just our members, but people across Ontario asking, what is happening in our hospitals? They are locked out. They cannot support their mother. The call last night was horrific. It kept me up last night. This woman was beside herself, and the emotional toil that is expressed is daunting me. She cannot understand. Her mother is a vibrant woman in her young 80s, now in hospital. She can't reach a glass of water. She feels like she's a burden to our workers. She feels like she's not getting any support because she's old and frail. This is an ageist attitude that people may have, but this is a real situation where our elders are feeling like they're unvalued. This is not our system here in Canada. We know that they are. We got to do better. And to hear someone at the end of the phone in excruciating pain, emotional pain, because they cannot support their parents, and they understand as a retired nurse what those workers are experiencing themselves. When her mother says, I just don't want to live anymore, this is unnecessary. It is a humanitarian crisis in our hospitals. We need to get in there and we need to get them some support.
Thanks. We're hearing that for sure. And we're also hearing from patients who just can't get care because their surgeries are canceled, their diagnostics are canceled, and they're not, to call them elective surgeries is, the public doesn't understand that. These are surgeries that if they're delayed, the health outcomes for the patients get worse. And it's very, very serious. We're looking at irreparable harm to patients. So Nick and Sherry quickly, and then we'll come back to questions.
Yeah, I just want to throw in there that the stress that the nurses and the PSWs are feeling, the essential caregivers are feeling the exact same thing. We walk into the homes and then we see, residents sitting there with not being cared for. So we try to step up and assist in feeding and help them as much as we can. So the stress of walking in as the PSWs and the nurses, seeing these people hopeless sitting there, the amount of stress and what it does to a person. We've not been trained. We're not trained for that sort of stuff, and we see it live, and it's horrific. And I guess if people are just it's insane. I don't know. There isn't. I don't have words to describe how bad it is for nurses, PSWs, and for essential caregivers to go in and see that and do whatever they can to help.
Thank you, Nick and Sherry.
You want to even just look at statistical numbers with falls, like this past lockdown that we've had is astronomical. 3 right before breakfast. You're the only one on the floor. You've got 3 wandering around that shouldn't be walking because they're going to fall, and there's only one of you. Where are you going to go? Who are you going to catch first? Bed sores out the wazoo. It's just incredible how they're just not taken care of. It's just plain and simple. Yeah.
Okay, thank you, Sherry. So I'm going to go back to questions from the media. There are several of the family members who have their hands up. I'll come back to you. I just want to make sure we get all the media questions in, and then I'll come back to you. Go ahead. If there are any other media questions. Are there any? Okay, so seeing none, who was it from Castle Home who was waiting? I'll just take the 3 of you and then we'll close down. So,
Okay.
well, go ahead, Bonnie.
Okay, I just wanted to say that I'm an essential worker. I was for my mother. She died January the 4th. And I have to say that Castle Home was excellent trying to deal with everything they have. They just keep pivoting with new legislation all the time. They were always open to helping me. We had some issues about dehydration and that, but I have to say, I can't even imagine what that staff is going through after 2 years of doing the same thing. So I certainly support all of your rules that you're trying to get through to the government. Yeah,
Thank you very much, Bonnie. Thank you. Okay, Rainer's got family members in long-term care and in home care, which is crumbling also in a very, very serious way. Go ahead, Rainer.
Yeah, hi, I'm Rainer Petke. As Natalie mentioned, I've got a disabled son in long-term care. He's basically been dumped in long-term care because there should be residences just for them. Now, with outbreak, locked in his, well, I shouldn't say locked, confined to his room because they're not allowed out, no activities, no stimulation whatsoever, just waiting for someone to come in, give his meds morning and night, maybe help change a diaper. That's no way to live. Then on the home front, well, first of all, I can't, as an essential caregiver, we're restricted to 1 at a time. Like the rules that this government is making is crazy. Like, why can't, the home is asking for help. Why can't we go in and help? Right? But then even if I could, I've got a 94-year-old mom at home and her care has mounted to 1 day so far this week. She's entitled to 7 days. At 94, she needs help getting, feeding, getting dressed, those things, and it's just not there. So that's really what it's like at home for the residents of Ontario. And then you have Bill 124, that just adds insult to injury. That's a slap in the face for the folks who are just trying to survive at home with what's going on. Thank you for letting me speak.
Thanks, Rainer. Yeah, so that home care crisis, they just don't have workers to show up for the shifts. And so people just, care just doesn't show up. That's what happens. It just doesn't
Well, that's
happen.
exactly it. I mean, they're lowest cost compliant. So they got, just like the government is doing with everything else, here's your funding, you won the bid, and they try to do with what they can. And as soon as somebody gets sick, well, they just have no extra staff.
Yeah. Okay,
And
thank you.
every one of my mom's care workers got COVID. We're trying to deal with that as well.
Oh my God.
Yep.
Okay, thanks, Rainer. And Carol Dueck is, she's the chair of the advocacy committee of the Family Council Network that covers from Hamilton and Burlington down to Niagara. Go ahead, Carol.
We've got about 86 nursing homes, and what we're hearing is the families are terrified. They're frightened. They want to know what to do. Excuse me. You have one or two people saying, what do? We can't go in. And on the other hand, we'll get administration calling to say, come help us, not just to look after your family, but other family members. And it leaves that who's going to teach us? How are we going to get to know? The other part of the trickle-down effect of all of this is the administration. We've got CEOs and directors of care and managers that are leaving or burnt, or they just close the door and want to cry because they can't help the staff anymore. They're responsible. They're going to get an inspection report and they can't do anything about it. So it is just one gigantic vortex. And we just need to stick together and see how we can help one another in a very forward-moving, sharing ideas and having the ministry listen and move forward as to what we're going to do next. Thanks.
Okay, thank you very much. Are there any other questions from media? Okay, so I just want to thank you very much, everyone, for joining today. This is critically important. If we don't see action within a week, can we commit to each other that we'll do it again? You know, our message to Doug Ford is we're not letting you off the hook. You know, you don't get to do PR announcements that mean nothing and not be held accountable for the absolute staffing emergency that's happening across the healthcare system and not addressing it. So we will carry on, and thank you very, very much to the media for telling this story. It's so critically important. Thank you. Bye, everyone.